Confusing recommendation, guys. A popular test used to screen for prostate cancer is now being called by some ineffective. So this morning we want to turn to a local expert. Dr. Jankowski is a urologist with Riverside Methodist. Thanks so much for coming in this morning.
Thank you.
So basically this national medical panel is advising men against using what's called the PSA test to screen for prostate cancer. First, what is the PSA test?
It's a simple blood draw that previously, and in my case, I still recommend on an annual basis, simple blood draw that's done at the doctor's office or a lab.
And a way to then effectively screen for prostate cancer?
I believe so. Yes, we recommend that be done in addition with a digital rectal exam on an annual basis. So,
what age typically do you recommend that they do this?
Certainly a man in their 40s, and also if they have, definitely if they're African American or have a strong family history of prostate cancer, we would recommend beginning at the age of 40.
Why do you think the panel's recommending men do not do this screening?
Well, it's not a perfect test, and there's certainly men that have an elevated PSA. There's other reasons that the PSA could be elevated.
And what is that? What is the PSA? Is it just something like in the blood that...
Yeah, it's an antigen that's in the blood. It could be elevated if you have an infection of your prostate, if you have benign enlargement of your prostate. And so just because it's elevated doesn't necessarily mean you have prostate cancer, but we don't have a better test at this point to screen. And so the study that was done contends that we're doing too many biopsies and that people are being treated for prostate cancer, which the cancer may never affect their life.
Is this a case of, I know that you're not alone with other urologists who do still recommend this, the PSA test. Would you say that still getting this testing done is a case of being, better safe than sorry?
Well, I think until we have a better test, I think it still should be done. And quite frankly, once you do have an elevated PSA, then you need to have a discussion with your physician or urologist about where that leads you. But it's a piece of information that can help us guide therapy, and I quite frankly would continue to recommend it for my patients.
I know we don't hear a lot when it comes to men's health about prostate cancer and getting the word out there, so when a news of a study like this comes out, at least it gives us an opportunity to talk about it. So again, you say that you yourself would recommend, in addition to the traditional testing, annually.
Yes. If you look back, before we had PSA, in the 80s, the mortality rate for prostate cancer was steadily increasing. PSA was introduced in the early 90s, and since that time there's been a decrease in the overall mortality related to prostate cancer. So that in and of itself, I think, is a strong indicator that maybe we should continue using this test.
All right, Dr. Jankowski, thanks so much for your time. We certainly appreciate it. Lisa, see, now we know, because guys, we got to look out for ourselves.